From the very start of the consideration of repealing Obamacare, I've placed stress on eliminating the requirement for the 10 essential services that have to be covered under Obamacare in every insurance policy. It was a serious mistake to include those in the first place because it drives up the cost of the premiums at the price of appeasing the special interests behind each of those medical categories. But there is no reason to require everybody to get mental health services, addiction, recovery services, maternity benefits, all kinds of stuff that may not be appropriate to them. And we should give people a free choice to have bare bones policies or moderate policies covering what they want. It should be like, the menu in a Chinese restaurant. Take one from column A and one from column B and mix and match it as you want. And that's the essence of the Ted Cruz bill. So he says that if any health insurance company offers the full range of services in one plan, it can offer anything else in other plans that it places on the market. And that will make consumer choice very widespread. It'll bring premiums down significantly, and when premiums come down, more people will be buying insurance, which is an important national goal, and as more people buy insurance, the premiums can drop. Now, there is a concern that this might prejudice people with pre-existing conditions. And what they mean by that is that enough young people will buy policies that are all they need, that are strictly catastrophic or relatively limited in coverage, and their premiums will no longer be available to subsidize people with pre-existing conditions who need the full soup to nuts insurance. That's the code of what they mean. They don't want to say that because they don't want to say they're in effect taxing the young to support the elderly, but that's about what it boils down to. But that could be handled in many different ways. It could be handled by subsidies aimed at the premiums of people who have the pre-existing conditions. Obamacare itself has a pool of those people, an assigned risk pool, if you will, and they get special advantages. You can deal with that in many ways. The Cruz Amendment is the key. The other point is to realize that Obama had a complete sleight of hand when he told everyone 20 million people are insured under Obamacare. Well, they're not. About 10 million are, and 10 million are on Medicaid, which is old-fashioned welfare. The program's been around since 1965. And to lump them together is absurd. There is all the difference in the world between the relief due to somebody who is struggling to pay their health insurance premiums and someone who's getting a free ride on essentially a welfare program. And we should separate those two, make sure the insured are taken care of, and then with Medicaid, we should do things like impose small co-payments, $10 for an emergency room visit, so that people don't overutilize it, and work requirements because it is a welfare program, and so forth. But I think that the Cruz Amendment offers the key to untying this knot. Thanks very much for watching.